This is so terrific, and thank you all for joining. I think I do want to start with maybe the answer to your question on HR and not enough women representation. I think we're changing the data a little bit with the panel today, which is pretty amazing. So when I saw the panel and I saw the distinguished, not just the people, but the experience that's part of this, and tying it with His Excellency's comments on what the federal government is doing here, I thought it would be really important to think about how it's being effectuated with the citizens at a deeper level. So we've already heard about how the UAE's ambitions to turn a digital economy into an AI-enabled economy is happening, which is so terrific. Today we get to get real deep into how the economy transforms with what seem disconnected but are actually connected areas between healthcare, between climate, and of course the government and trust of what AI should take over versus what humans still need to do with Dr. Melodena here. So I'm really privileged to have all of you, and maybe I can start off with a few questions here with Your Excellency Mubaraka. Thank you so much again for joining us. I just wanted to get a sense for the audience in your role with both digital transformation and AI as a leader in Emirates Health Services, how you translate the national AI vision into measurement or measurable improvement in people directly. Your role, your facility, actually directly impacts humans in the most critical and the most personal way. So I'd love to get your perspective there.
Well, thank you very much first for hosting me. Very good question. Now, if you talk about the vision, how we can do that to translate it into our current work role, especially I come from the health sector, what I see is that the AI vision, people usually, they track it to be a technology vision. But honestly, now currently with His Highness Sheikh Mohammed bin Rashid announcement that 50% of our services to be an operation, to be an autonomous agentic AI, I see that this vision is actually a transformative vision for the services given. So going forward, what I'm trying to say here is that we need to look at the AI and how it can benefit our, clinicians, our, public, our community. The major thing here is that we need to see, yes, we need to implement it, but how this AI can affect our community. This is the way we need to take it forward. Now, there is an urgency. Yes, there is an urgency for that. If you see that market-wise, it says that by 2030, we'll be having 11 million shortage in clinicians or in the workforce and the healthcare as a totality. So with this means that we need to look into a better way of how we can utilize AI to help us to close this gap. Also, if you notice that currently they said that according to the latest statistics, that the market of the AI is actually increasing. On 2025, it is now currently 21.66 billion US dollar. And it's going to be increasing by 2030 to 10.61 billion US dollar. So there is an increase in how the AI is coming into the market. But the question is that we are not actually concerned much about the market increase within the UAE. What we are concerned with is how we can make this as a value to our community, to the people that we're working with. So going forward, how we can measure these type of things from my perspective is that we need to break the iron triangle. And when I say the iron triangle, three things in the healthcare that we are still seeing that there are challenges with: the accessibility, the affordability, and the quality of the service. So I think putting AI into this perspective, it will help us tremendously in managing the accessibility, because with the Agentic AI, now we are actually seeing, as said by His Excellency Ibn Talaa, that you can book an appointment online for your haircut. Imagine you have an Agentic AI who is a physician that you can have easy access to. You don't have to wait that long for you to get a service. And also look at how it's going to be, make it affordable. Because with the predictive analytics, with the, with the different type of tools that you can use, you can actually reduce the cost. You can actually elevate that, you can lessen the number of the workforce, because you'll be having Agentic AI that can do a lot of work that can reduce the burnout. So and also you can see how you can do the quality of the service. When it comes to the quality of the service, you are using AI to tell you how it will help you in the prediction, it will help you in the diagnosis, it will help you in, in giving the better quality of care for your patients. So as an overall, I think this vision of the UAE is a public value vision. And going forward, I see it will help us, especially in the healthcare sector, of how we can deliver healthcare that will help us to reach a happy and healthy community.
That's terrific. Thank you. The triangle I like. I didn't think about it that way, but accessibility, affordability. I think the trust is equally important, as you brought up. Just to follow on that, how do you, I think the ambition and the transformation is 100% required. How do you balance what families, children, the personal touch of healthcare, where people are used to that empathy of a clinical visit, with the advancements in AI, where you want the human touch with all the things that you want to achieve?
Yeah, I know that question comes a lot. Does AI takes over empathy? From my point of view, it's the opposite, honestly. I'll explain to you why I said that. Because healthcare is not about transactions. It's actually about openness. We are seeing that when we are introducing AI, we're not introducing it to make the people anxious. We are introducing it to make the people trust the process, that there is actually a way of defining certain ways and managing your health better. Especially now, as you know, the wellness, longevity, all these type of things are some of them, or most of them, are driven by AI. I'm a person who's wearing my ring all the time. That is a way for me to manage certain things about my health. And this is based on AI. If I don't trust it, then, the challenge will happen. But worldwide, we know that currently there is a burnout, as everybody will know, and there is a huge shortage. And I see that producing the best agentic AI to help, that will be something that we need to build a trust first, as you said, and also we need to see how we can get, let me put it in other words, our people to see the benefit of it. How would it benefit them? I will give you an example of what we're doing in the EHS. We have actually launched 2 of our major agentic AI, and we are now currently in the proof of concept to see how they can help us. We've done Amal. Amal is our first AI physician, and it is actually doing, it's the face forward to the patient. So whenever he wants to have an appointment, he will definitely direct, and Amal will come. She will welcome him. She will be having his medical history, because she will be connected to the file of the patient. So she will listen, depending on the case or depending on what he's feeling. There is a lot of questions that Amal will ask, and then she will, make up a medical history for that patient, and then send it over for the clinician to take over. See how much time you are saving for the clinician, so that when the clinician comes, he will have more time to sit and talk to the patient, because everything is in front of him, his medical history, what he's doing, his chief complaint, and all that. So with this, this type of agentic AIs is actually giving more time. I am not saying it's giving more time to our clinicians and to our administrators, to our people, to be having more time to be empathize and listen and interpret and give the right diagnosis to the patients.
That's really helpful. And so the concept is more enablement of quality time with the clinician
Yes.
rather than replacement of that time
Yes.
and that empathy. That's great.
And there's a lot of things that we have also done. We've done something around our workforce, and because, we have a visionary leader, and we are blessed to have His Excellency Dr. Yusuf Sarkal, and he's usually telling us, look ahead how we can help our patients. So we have actually worked currently also in doing another agentic AI, which is called Metha. And we try to get the name Metha. It has an Arabic meaning behind it, the strong, the fair. So it's actually our workforce, but we have done it for the nurses. Because we know we have now currently, and everybody knows that nurses are one of the major, I can say, إحنا نقول لهم ملائكة الرحمة, yeah, the angel of, say they are actually the one who are 24/7 with our patients, So with this, we have to recruit the right nurses. We need to know and assess their capabilities. We need to do their care pathways and engage them. So we have done that agent to start working with us. We have done assessment, we've done recruitment, and we've seen a huge accuracy rate in getting the right nurses and the right with the right specialities, and that helps us in reducing also the burden for not getting the right patient with the right nurse or with the right physician. So there is a lot of things that this type of agentic AI can help us in the healthcare itself.
That's terrific. That's terrific. Can I ask you if, again, going back to, I'm fascinated that there's this personal nature. We hear a lot about AI, agentic transformation in different industries and now government, which is just really compelling. The personal nature of EHS and health and clinician work is so important that it established a lot of, to establish trust and privacy of data of a person or their families. What are governance principles that you think about? And Dr. Melody, please to chime in here too, but I'd love your perspective as EHS, how you think about the governance around the management of that data.
See, governance is a must. If you don't have the proper governance, it's a risk. But governance also without innovation is stagnant. So we need to work it out together how we can make this governance that's trustworthy and something that at the end of the day will ensure that whatever algorithm that we have built comes out with the right, correct results, our outcomes for our patients. So what we have done in the EHS, we've taken governance as an institutional policies. So we have developed our own internal policies, and it's actually published in the online. And we are the first entity within the healthcare who have developed this, policy for the AI in totality, not only around agentic AI, where we are actually looking at how we can do, the privacy, the confidentiality, making sure of the data sovereignty, making sure that human in the loop is there when we're doing that. So this policy is already being published internally, and it's been actually implemented 100%. Plus, we have done our AI work, AI framework, where we have actually based it on the HIMSS 5 rights, and with that one, we have got recognition by also major, organization like the HIMSS and also WISIS, which means that UAE has said we are actually setting the benchmark when it comes to that because we are caring for our patients. It's not like I'm running to implement something. It's more that implement it safely and implementing in a way that I will build the public trust. Otherwise, whatever I'm doing will not be of any value at the end of the day.
Absolutely, that's terrific. And just, last question, just building on what you said, particularly with human in the loop as a governance policy, how do you prepare the nurses, the clinical staff, the organization, the administrators, the digital teams to confidentially work with AI? How do you both maybe skill them, but also help them, effectuate some of this governance? Yeah.
One thing that has been, seen at the United Arab Emirates is that, yes, they want to implement AI, but they want to skill the people in the AI. And if you notice, at the level of the UAE, there has been national programs of upskilling. Maybe a year back or 2 years back, there was one initiative with the Microsoft for 1 million, that they want to upskill. And also now currently, I know that there's something with Google. They're also working on that direction for checking the maturity of where we are as an entities when it comes to the AI. But also, going back to your question, how I can build a trust is I need to put them part of the process. For them to see, transparency is a must. Being there with them when they're developing algorithm, because we are actually going to be also upskilling them. What we have done in EHS, we've initiated something called Masar al-Dhaka, which is an initiative that we have done in maybe a year back, when the strategy of 2031 was published. So it has a major element into it. It has three elements. It was first, the element is the awareness and the upskilling. The second element was integrating the AI in our healthcare services. And the third element was around the safe use of AI. So in these three pillars that is there, actually, we worked on developing certain programs. So in EHS, we have a learning management system called Maharati. We have actually introduced 26 courses on that platform, where we have encouraged our staff to take the learning. Till now, we have reached 7,400 of the staff who have taken that, training. So there is an upskilling that's happening. With that upskilling, you can see that the confidence is coming, because they come to know what is the advantages of AI, where it can help them. And as has been said, now you can do your own agent, and it does for you a lot of work. But when it comes to the healthcare, because we are dealing with lives, we're dealing with the human lives, it's a little bit more, let me say, we need to be a little bit more cautious when we're talking to the people about it. Because, according to the latest statistic, they said 50 to 70% of the people are not happy they're a little bit cautious about using AI, especially in healthcare. But seeing how we in the UAE are very proactive, how we are engaging the people, how we are getting we are actually doing surveys, and we are introducing these type of new initiatives, and also training them. And I think the training is a must. Building the trust is a must. Being part of the process is a must. And having the right governance is also a must.
That's terrific. Shibani mentioned that Marco founded Keystone, and he's a visionary. He built the digital technology program at Harvard, and him and I always debate this. I come from the risk world, and where I almost feel like I'm preventing innovation because of the guardrails. And he's always thinking about, like, how do we let companies flourish and grow? And I just want to commend you, because the industry you're in, to continue to have innovation drive so much change is really remarkable. So it's really terrific to hear about your principles and your approach. It's really remarkable.
And I actually want to just also thank our physicians, because I've noticed that currently they're also more proactive to know more about AI. And they're really, they come to me usually, we want to learn more and more, and how we can help you, how we can work together. And we have established a very beautiful governance structure, where we have certain committees, and each of the committees is responsible for certain use cases. So whatever use case they will develop, they are the one who's responsible for, building it, making sure that it's being verified, and at the end, when they're implementing it, they are monitoring that, it's the success outcome of it.
That's really, really terrific. That's the right way for organizational change. That's great. Your Excellency, Amal, if I may, I don't know if I'm going a little off script because of what I heard before. First, I just want to, I hope it's okay to mention this. I think it is. I just want to mention the organization, I think today is when you got the award, if I'm not mistaken. There's a zero bureaucracy award that the government issues, and some of you may be familiar with it, but if I could just commend, and maybe you guys can just kudos Your Excellency
Thank you so
Amal.
much. The announcement will happen soon, so everyone will have a great idea about the award. Thank you for mentioning that.
Oh, no, of course. It's really remarkable. You know, it's one thing, I've been in the UAE 3 years, and a lot of the principles I think of with Keystone are transformative ideas, uncommon service, and to see it in practice, to see it actually happening in government, and then a recognition in the government for it. I was so pleased to hear that, just to say that it's not just words, it's actually happening, and so kudos to you. It's really remarkable. I'll start with a little bit around environmental intelligence. You know, your background, the work you're doing in climate and environmental decisions. I think of data, I think of technology historically as learning from past, and AI gives us the ability to start learning and possibly predicting for future. And so when you think about, you know, maybe one or two things that the changes you've done in your leadership and you're expecting to proactively benefit from AI as in climate for UAE, how do you think about those principles, or maybe like one or two examples you could talk about?
Sure.
Yeah.
Thank you so much, first of all, for having us, and good afternoon, good evening. It's almost, and thank you for taking your time to spend it today here in the panel. I believe this is give us a huge sign that we would like you to leave the space with at least one or two takeaway. And also, before starting, I would like also to thank Mubaraka. She's been part of my journey for the past couple of days. Thank you for calling the Agentic AI Amal. Yeah, so I've been, yeah, so it's like Amal translates to hope, which is something we really seek for. So let me just start my opening with a bit of a larger perspective on the AI and strategy. I myself, Amal, I'm a product of the UAE strategy, specifically AI. When the announcement happened back in 2017, I was part of the Prime Minister's office team at that time. And one of the initiatives within the strategy was to train 100 leaders in AI with Oxford University in a first AI program. So everyone was like, what is this program? We were used to innovation, leadership, change management, risk management, technology, but AI, what does AI mean? So 100 people doing the same program, traveling to UK just to have an idea about what does AI mean at that time. And believe it or not, the main concern that back then was the ethical consideration. And a couple of use cases there and here, and you know, the idea of implementing AI technology. And I believe we discussed one of the sessions, we discussed the Watson in the healthcare sector, and it was a huge failure because the technology itself was amazing, great. I worked today, I'm using Watson technology, but not for doctors. Probably the why at that time was because it did not involve the doctors while they programming this agentic AI. So it's very important to have the right people. And when you ask me today, is Amal the same person as Amal who did the program 6 years ago? I would say like I'm 99.9. I'm totally different because, you know, when you learn in universities in the theory, it's different when you go and work in the real environment. So I have a philosophy in terms of translating any AI strategy or any AI in any sectorial sector we are here in UAE. There is a huge difference between intention, adopting, and implementation. I believe everyone has the intention to adopt AI, new technology, but who is ready to really adopt and take the risk? Because as per the latest report by World Government Summit and also the World Economic Forum, that 90% of AI use cases fail. So we need risk taker here. And the third is the implementation, because when you are on ground, whether you are in public or private sector, you face difficulties, you face challenges, whether it's an infrastructure, governance, challenges coming from people, because it's a culture thing. And the change management itself as a concept, because using and adopting any AI technology, I would say generally technology, it requires a lot of intention from people to do it. So I would say in the climate and environment sector, taking this cascade with a national agenda, when we say UAE is very advanced in terms of strategic planning, and it started way longer than other countries. Not only adopting or appointing AI minister, but also appointing youth. I think someone asked about youth. We had the first youth minister in the world. So it is important that we do understand that our government has a great ambition, but we need people who are ready to do it. So because I worked, probably from my resume, you see that I worked in education and I do work in the climate. I believe every single sector is correlated in a beautiful way. So when you talk about health, it's everything connected to nature and connected to environment, and you will result into healthy society. So we build our strategies internally within the ministry in very much alignment with the government perspective, but it's also what we really need today. When we launched the Net Zero Strategy 2050, it's a very challenging strategy. It has 6 sectors, not only the Ministry of Climate Change, Environment responsible of applying this sectorial strategy, because there is a huge difference between sectorial strategy as net zero and institutional strategy. Institutional strategy is something within the environment where we can control it. But once you have sectorial, it's a more challenging one. So we have health, we have transportation, we have industry, we have Ministry of Climate Change and Environment, and we have to work in alignment and huge day-to-day activities. So we don't work alone. This is I would say the UAE secret, the alignment between federal to federal, federal to local, local to private. And when you said about winning the award, it's not about winning the award more than are we really serving our customers? We deal with very niche type of people. Climate and environment, it's an international topic, but you have to segment it. We have the global and you have the local. You have the farmers, the fisheries, and you have also the companies who are ready to work in the country. I give an example of the net zero strategy, but I'll give you more relevant example, the food security strategy. We faced the last couple of months, I would say, glitches, but we are out of with this challenge stronger, more resilient, and it was a beautiful way to show how people are connected because they love this country. So we had no problem having any items or food in our grocery shops because of what we do. Integrating strategy, technology, AI, people to be able to deliver what we are supposed to deliver. Yeah.
That's really terrific. I think one thing you have undersold, which I think is also remarkable. Also, I heard before, you talk about the government alignment and why it's still so much people-based where you have to align the verticals to have change happen. But one thing I also admire, I believe, on the environment side is, with you and your team, you're listening to the people, the fisheries, the environments. You're getting feedback from the ground before you're making decisions, which, again, I don't think is a comparable situation in many governments. And so I'd love your perspective on the effort being put there that impact the decisions on what you're thinking about with climate going forward.
It's probably the impact, but since I come from a very scientific background, and I believe the climate and environment sector has a lot of scientific elements, so we cannot work without academia. they are an important part of what we are seeking to do. So as a ministry, one of the initiatives, we are working with the Mohammed bin Zayed University of Artificial Intelligence. We almost work with majority of the UAE and international university in multiple angles, be it food security, be it food safety, climate change, CO2 emissions, things related to service providing to the goods and services entering, exporting from the country and outside the country, as well as policies and legislation on areas related to biodiversity, marine life. So we have a lot of verticals in the ministry. One of the jokes I always say that when I entered when I joined the Ministry of Climate and Environment just 2 years ago, because 1st of July I'll be completing 2 years, I thought it's okay, a small ministry in compared to other places I worked before. I was mistaken. Honestly, it's like 3 big, when you visit any country outside UAE, you will see the environment is separated from the agriculture,
Right.
separate from the food security, and so each one of them are important and separate, but I believe this is our uniqueness, that all the sector is interconnected. When it comes to academia, I'm a researcher myself. I ask myself questions, and I have a lot of problem statements like happening every single day in my brain. And one of the very well-grounded theory, I think you are aware about it, Doctor, is the dynamic capability theory. So what kind of capabilities we need to implement within our institutes? You see my title? It's beautiful and long, but it has a lot of challenges and it has a lot of positive things also. I'm responsible about support services and AI. Support services, which means people, I would say, at the heart of organization. So every single use case we are implementing today, it was implemented by people, not by ML. So I always look at them and say, all of you are chief AI officers. I'm not the only one. I'm just here to guide you. I'm just here to make sure that we are heading in the right direction. But it's our responsibility to be chief AI officer, even in our personal life. How many people here downloaded AI application in their phones? All of us. I would say not less than 5, maybe 10. How much do you pay for each subscription? A lot. Some of them you unsubscribe also. So this is exactly what I'm keen to research on in future. So what is the impact of the day-to-day activities into what we do?
Speaking on impact, I think just to put some numbers, I believe last year the average monthly rate in the first half of the year for token usage, so the compute power that comes from, was something in the $300,000 to $400,000 a month, dollars, just globally. Now we're at about $3 million an hour of token usage. So just to show you the adoption of AI in the audience and other people using it, I believe those numbers are fairly accurate on a magnitude basis. Given all that compute power, given the climate obligations you have, as you know, a lot of the data center work that's happening here requires a lot of energy and water cooling, fresh water cooling. How do you balance both, creating that demand and making sure from the environment perspective? It's great that you have these two hats, so the environment as well. That's why I'm asking. I hope you don't mind.
It's a very powerful question, but the good thing that we are not the only ministry or entity that we are responsible about delivering the answer to this specific question. It's a collaborative approach. It's being mindful of what we do today. That's why you see a lot of UAE government big initiatives regarding GPUs, and you heard about the AI campus happening in Abu Dhabi, and it's supposed to cover probably 1/3 of what is the computing power the global world will need it for the next 10 years. And it's very important not only to think about the consumption of the computing power, but also think about the infrastructure itself as just the foundation of the next 10 years. His Excellency bin Atli'a mentioned that we, in the next 10 years, for advice for young people to be AI ready. But I would say we have to be AI responsible. So responsible whether from the infrastructure element of it, or from the human, or the processes itself to serve our country in the best way. It's beautiful when you put numbers on it, you know, because while we are advancing in AI and infrastructure, we have cybersecurity threats at the same time.
Right.
So if you compare the cybersecurity DDoS threats from 2019 to today, according to the UAE Cyber Council, it's 800% extra. Right. In a daily basis, UAE gets more than 200,000 cyber attacks. So we are advancing in everything, but we have to be very responsible at our organization at a corporate level. Imagine the data on the climate, the CO2 emission, the green gas emissions, the data on the waste, the data of services. We have to make sure that this data is very well protected.
Right.
And here it comes to the question is how we translate the need of AI into a very mindful governance system.
Right.
And this is exactly what UAE is doing, and this is exactly where we are at this stage.
It's a great proof of concept what the government's doing just for the world. It's really remarkable. I am just good segue. If you don't mind, I'll spend a few minutes with. Thank you so much with Dr. Melodena. I apologize. With all your experience in governance, you know, as we're talking about governance in healthcare, we're talking about in climate and environment. When you meet executives in organizations, if we think about that, what would you think? There's so much power is making decisions for their people, for their citizens, for their employees. How do you think about governance as a test for these senior executives? What should they know? What's the minimum baseline before they should be armed with making really powerful decisions that impact their employees and possibly their consumers, from your perspective?
Thank you. So just out of curiosity, how many people are coming from a business background as opposed to government? Show of hands. Okay, great, fantastic. So if I take from a business lens and I'm going to look at it from a leadership challenge, right? What is leadership? The first thing is a leader needs to steer or guide. And today we're at a point in time in history with the inflection, and I would say this started with COVID in 2020 when we all started adopting online stuff, that we are at an inflection point. We really need to take a sit back and we've got to ask that question, why are we using AI, right? So that is an important one because it will define our purpose. The second thing is, how are we using AI? And it comes down to your teams. And your team is human, and you've got an AI counterpart. Now, this is like having a human and a teenager, because this teenager has been told all its life, you're brilliant, you're great, right? It's been trained on information that comes from human beings, which is great again. And we've got now that purpose where we have to implement it. And here's where the dilemma comes in. When did we start collecting the data to train AI? From 2000 maybe? How many of you have a digital footprint before 2000?
Yeah.
So how accurately is it representing you? Today, most of the data online is actually video. 80% is video. How many of you are putting up huge tons of videos of yourself online? My mom, 0. She's a consumer. So we are at a point in time where there are people being left back behind because we're not collecting their data. Here's another important thing. You as a business leader must be able to think in this human AI thing. How much of that data is actually codified? Because right now, only 80% is in people's heads. 20% is what you write down. So we have this knowledge transfer issue. So when we start assuming that what AI can do is everything that the human being can do, we're seeing this problem already. We fired a lot of people in 2020, then we're trying to rehire them,
Right.
but they've lost their skills.
Right.
So we're seeing skill obsolescence. So as a business leader, you must make that decision in this human AI teaming is what is the role of the human being? And you need to value it. Sheikh Mohammed says, people first. right? So you need to value the people and their knowledge, and you have to also decide a pathway of skills. Young people are not going to learn in that skills pathway unless they have experience in that sector, unless they have knowledge in that sector. Talking to ChatGPT is not knowledge, not enough. Right? So I'm thinking about 20 years from now when I have somebody who's maybe a teacher, a doctor, engineer, and you think about, well, what is the skills that they need? What is the knowledge level that they need? And have we given the right tools to do that? And the last thing I think is an important thing in leadership is resources. How are you going to do that? Right? And one of the important things why business keeps failing when we think of failure is they underestimate the technical debt. The technical debt for AI is very high.
Right.
It's about 40%, right? And every year you need to count for that. In fact, cybersecurity is about 20%. So if you've not built that, if you think an AI project is 1 million, but you've not considered the next year the technical debt, you're going to fail because you don't have the resources. Add one more challenge. Every 5 years, the capacity for storing data, the technology behind that changes. So you have to take all your data and transfer it to a new hardware, and you will have data loss, right? Have you factored that inside, that every 5 years you would need to do that? So I think there's some interesting things from a business perspective for you to consider, and if you don't consider this, your AI projects won't be successful. So if you can think about that, and think about the pivots that will happen around the world, right? How are we using AI? And I want to just add one more challenge for business people, right? If human beings, the fundamental structure of human beings is human connection, and we're not perfect. Right? I can talk to an AI agent, it will love me, and I will love it because it never argues with me. But the fundamental human being is imperfect, and I need to deal with them. And if society is breaking down, we're seeing this in the Western world. Huge amounts of depression, people who don't know how to deal with anybody else, people who think, okay, the only way to solve this is to, punch somebody in, and that's the way to get it done. How can I change the fabric of society using AI? So it's not talking to more bots all the time. It's about talking to a bot and giving an opportunity for human interaction. And I think that's really important. So I work at the Mohammed bin Rashid School of Government. We're just launching a new program tomorrow, which is the Master of Innovation in AI Governance. And so much of this is about the human fabric. And we take our directive from Sheikh Mohammed, who says people first. And I like that because people first means people are not perfect, but I've got to also understand what I value about human beings. And every time I ask students, what is a human being? They struggle. Because everything they say that a human being is, I can think, I can smile, I feel emotions, is what animals can do and everything else. So we're at that fundamental stage.
No, that's really terrific. It reminds me, His Excellency earlier had mentioned that the principle of the transformation that the government has set in 2 years is really based on the people. It wasn't driven by, EBITDA and margins as we think about in the business side or, spend. It was how can we make the people's lives better as a fabric of society. That user experience is so important. Doctor, you've also, in the past, you've warned that AI should remain a tool to improve human life and not become the master. I think that's a concept that you've talked about. What are the early warning signs of an organization, a corporation, that the edge of AI is becoming more of the master and less of a tool? And it sounds like that's a risk that you're foreseeing, or foreshadowing, rather.
So again, I'm wearing the private sector hat because I think the government's doing an amazing job. But I think listen to the people. So one of the challenges is when we start loving AI for the sake of AI, and we've seen that historically throughout history, right? We've seen obsolescence happen when technology, and we stay in our own lane. People generally have a good sense of what's happening. And I'll take an example that's not to do with AI as an example. Kodak, right? Kodak was all about making film. They were the first guys to come up with the digital camera, but they failed to realize when people were capturing pictures, it was about sharing memories, right? So they lost the track. You think of Motorola, you think of BlackBerry. We see all of that. You mentioned Watson. The funny thing with Watson was the old pictures did not have the quality of the new pictures, so that is why it became obsolete also very quickly, because the new technology could not give you the fine-grained diagnosis. So we need to, and the question you asked was what do we need to be aware is, I just think listen to people and get the signals, because they will know on the ground what's not working. Watson didn't listen to the doctors, which you mentioned quite this thing. Kodak didn't listen to its salespeople or its internal research people.
This is super, super helpful, and thank you so much for your insight. I think it sounds like we learned that AI is not just a technology anymore. Everyone's established that. It's not just a change in technology, but it's a new way of operating with trust, with governance, with people that we all have to acclimate to. And so that's the exciting challenge we're taking on. Well, thank you so much, Your Excellency, Doctor. Thank you.